Hey y'all, it is Ruby Jones, your favorite dental diva, here to go through some tooth identification practice. Make sure that you're asking yourself these series of questions. The first one is asking, is this a maxillary or mandibular x-ray? Because that's going to help you bring the number from 32 to breaking it down to 16, okay? Next, you want to ask, does this belong on the patient's left or the patient's right? Remember to never think about our left, our right. It is always about the patient's left or the patient's right. Now that we decided that it's an upper or lower, now we decide if it's a left or right, we've broken that large 32 all the way down to 8. Okay, so once you do that, now you want to look at the specific characteristics of the tooth itself. Okay, so the tooth that has the X on there, is it a large, wider tooth? Kind of alluding to the fact that it's a molar. Does it look sharp like a canine towards the incisal edge? You have to ask yourself specific questions relating to this tooth to help you identify if it is a molar, if it is a premolar, if it's a canine, or does it look like the larger, wide anterior incisor teeth versus the mandibular central and lateral incisor teeth that looks very, very similar. So you have to ask yourself, what does this tooth look like it is, okay? Once you decide on that, you have to pick a tooth number, because the beauty in tooth identification is once you decide on a tooth number, you will cross-reference the tooth that is in front or anterior to it, and you will reference the tooth that is posterior or right behind it. Okay, so once you do that, for example, if you think that the answer is tooth number 3, in front or mesial to tooth number 3 should be tooth number 4. Okay, and if it is still wide like a molar, you can then confirm, you know what, this is not tooth number 3, it's probably tooth number 2. Okay, and so you have to look at what's in front and what's behind to help you decide, did you in fact make the right decision? And that right there is super helpful, and we'll go through some examples. Okay, so always referencing what's in front and what's behind is an amazing trick to determining if you decided on the correct tooth number. Okay, so let's get into it. Okay, so as we're looking at this x-ray, you should see the maxillary sinus, okay? That is something that you would never see on the mandibular. So from seeing the maxillary sinus, we already can determine that this is in fact a maxillary x-ray. So again, we took the tooth number 32 and we narrowed it down to something between tooth numbers 1 and tooth numbers 2, okay? So once we do that, we have to then decide, does this belong on the patient's left or the patient's right side? We have to put the molars to the posterior. Okay, we have to pull it in the posterior because it belongs in the posterior. And the only way to do that is by putting this x-ray on the patient's right side. Right here, you can see, putting it to the patient's right side, we bring the molars to the posterior. Then we got our premolars going towards the anterior. Now we're trying to guess that tooth with an X. It looks wide like a molar is. And next to it, we see that it goes from being a very wide tooth to a more narrow premolar. So I'm going to guess that it is, yep, you guessed it right, tooth number 3. Okay, so as you can see by us referencing the tooth behind and the tooth in front, we can then confirm and feel confident in that tooth number with an X that we're being asked about is tooth number 3. All right, guys, look at this PA. You should be able to see that that curve of spee is in the correct position. So your patient is happy. Your patient is not frowning. So that lets you know that the position of this x-ray is in a good position and the correct position. You should also notice that it's not that busy. We don't have too many landmarks going on. What we can see, though, is the mandibular canal. Okay, the mandibular canal is that thick main mandibular nerve. You notice I keep saying mandibular, letting us know that it is down at the bottom. So whatever tooth number we pick, it should be between 17 and 32. Okay, so once we know that it's at the mandibular, you got to be able to put this on the patient's left or the patient's right side. Okay, if we put this on the patient's left side, we would then be placing the molars going towards the anterior, which we know that would never be the case. So putting it on the patient's left side is incorrect. We would have to put it on the patient's right side for it to be anatomically correct, okay? Putting it on the patient's lower right side narrows the tooth numbers down from 32 to 16, now to 8 tooth numbers. So something between 24 and 25 because this is in the fourth quadrant. Okay, so now you see that we're dealing with some pretty wide teeth. You guys, these are the 3 molars. These are the 3 molars in the fourth quadrant. And you also know that it's mandibular molars because look at the roots. There's 2 roots, guys. There's 2 roots. And remember, 3 roots for molars are on the maxillary. So that was another indicator, another landmark that we could have referenced, okay? So looking at these 3 molars, what is the very last molar in the fourth quadrant? Yep, you guessed it, tooth number 32, okay? And because there is nothing distal, we have to reference the tooth anterior to tooth number 32, which is going to be tooth number 31. And then after that, you got tooth number 30, which is the 3 molars, okay? So I hope this video helped. I'm gonna make more videos because it takes a lot of time trying to break down one PA. I don't wanna make a super long video, so look for more videos just like this. Thank you.